One of the great things which David was alluding to was, as far as I'm concerned, is the Digital Health Technology Catalyst. Just before I get onto that, I just wanted a kind of a raise of hands to just get an idea of who's applied for Innovate UK funding in the past. Okay, a few people, not many. And how many people have been successful? Okay, that looks like even more, so that's even good. That's even better. So we must be doing something right somewhere. So before I just get into the Digital Health Catalyst, David's give a good overview of the kind of the Innovate UK family, but I just wanted to just touch on regards what's kind of happened with the investments that we made. So since 2007 when we started, so we've just reached our 10-year anniversary. We've invested £2.2 billion across many sectors. For every pound invested, we've seen a £7.30 return, and worked with on 11,000 different projects, or supported 11,000 different projects across 8,000 different unique organisations. This money has resulted in, on about average, eight jobs per organisation, so seeing an increase of 70,000 jobs in total. So I wouldn't be doing my duty if I didn't mention the Innovate UK piece, but now I can get onto the Digital Health Technology Catalyst. So it's a 4-year programme, which is, we've been working on the business case for probably about 18 months before it's actually kicked off. It's £35 million investment and part of the Industrial Strategy Challenge Fund, and we'll run over a 4-year period. We're working with many different stakeholders, including the Accelerated Access Review, so it was a recommendation of the review from a couple of years ago. It also aligns with the National Information Board's aims, and I've listed two of the ones which are most tightly aligned with the Digital Health Catalyst, which should be in address specific market failures so that digital health sector can grow. So that's very much Innovate UK's heart. And the one which is probably more at your heart is deliver transformative, cost-effective technologies to patients more quickly. So the aims of the competition is to speed up the development of new digital technologies, and we're looking at feasibility and development. Now this is probably, out of the slides which I've got listed, so there's probably about 15, this is probably the most important slide. And that is because of the target areas, which is basically the scope is all around improving patient outcomes, transforming healthcare delivery, and enable more efficient delivery of healthcare. So if you've got any questions about whether you should apply to the competition, look at those 3 bullets. And if your application doesn't meet any of those, then there are other opportunities that you should explore. So for the first round, and as I mentioned we'll further rounds hopefully later on this calendar year, followed by probably competitions every 6 months or so. We've got an £8 million investment to fund projects in this competition. I'll first of all touch on feasibility studies. So for feasibility studies, the projects must range from a total project value of £50,000 to £75,000. And they have to be led by an SME, so it can be single SME led, or it can be a collaboration. But all of those projects must be completed within 12 months. And then the second strand to this is the industrial research and experimental development. So that's a bigger pot of money. So we're looking at £500k to £1 million investment per project. Once again, it is business led and it has to be SME led. And these projects must be collaborative and must be completed within 3 years. There is one other key point which is very important. Projects must start by February the 1st, 2018. If we can get projects off the ground quicker, and we have to consider assessment, contracts and all that type of thing, I'd be delighted if projects started by the 1st of January. So now we get on to scope. So scope of the feasibility study. So the scope for this, projects should enable the exploration and evaluation of the commercial potential of early stage projects, and should focus on these 4 areas, but not limited to these 4 areas. So assessment of the business opportunity, validation of the initial concept, potential of the concept, and scoping for further development. So what we're looking at from this is, it kind of has a very much of a, is there the need for this solution in the first place, and then would that lead to commercial opportunities? So it's slightly different to some of the other competitions such as the Biomedical Catalyst, which may be more technically challenging. So as we move on with scope for feasibility studies, and this is another key slide. So they must offer new, novel and breakthrough approaches to healthcare delivery, must be focused on improving patient outcomes, and also reduce the demand on the healthcare system. Also provide healthcare benefits and improve clinical decision making. Now what we've done is we've been working with stakeholders, namely the NHS, Department of Health, to actually design this program. So a lot of these things would be very familiar because they were part of the 5-year forward view. So then when we get on to research and experimental development scope, these are the major 5 areas that we've identified. So tech development, design prototyping, the demonstration of the effectiveness of the solution, market testing and evaluation. And proposal must offer innovative digital approaches to healthcare delivery and must demonstrate the value proposition, clear understanding of the market potential, and also align with the Digital Catalyst's core aims, which is to grow the digital health industry, as I mentioned, and help get transformative solutions into the space. One of the most critical parts to this, and we believe this to be one of the key elements, is that collaboration piece, particularly collaborating with the NHS. This is where we see the end solution being far more valuable and in line with the needs of the health service, rather than developing a product in isolation. So the types of projects we're funding, I won't go through the whole list. You've got some of the usual suspects there, such as informatics, data analytics, clinical decision making. But we're also looking for disruptive technologies as well. So technologies that may be able to make a big impact in the future. So it may not be readily used within the NHS today, but in 3 and 5 years may have a big opportunity, such as artificial intelligence, which is used obviously to a degree, machine learning and blockchain. So cybersecurity could be another one. And it's also likely that if I was stood here in 2 years' time, we're going to see other technologies listed there too. We won't fund projects that, and this does have a very broad scope, so this list is quite short. And we did that for a reason, and the reason was I'm taking very much of an agile approach with this program. So over time, I'm looking to learn from this competition, future competitions, and all of the stakeholders, so that we can really design the program moving forward to meet the needs of the healthcare service today, but also in the future. So just 4 bullets. So we don't want projects that don't have digital technology at the project core. We're not looking for projects which is just a medical device. I'm not going anywhere near developing medicines or medicines discovery, and I'm not particularly interested in record-keeping systems. So we're looking for transformation with this program. We're also looking for a balanced portfolio. So we don't want 1 or 2 or 10 applications all in the same area. We'd like them spread right across the health service and make as much impact as we can. We're also looking for riskier projects too. So we're not looking for the easy option. Eligibility criteria is very simple. So UK-based SME. Project must be carried out in the UK, and the project must be able to start by February next year. Project collaboration is key for industrial research and experimental development. Could be with any of these partners, but the most important one, as far as we're concerned, is and the highly recommended, if it makes sense for the project, and not all projects will need an NHS collaborator, but the recommendation is to work with the NHS. There's basically a summary slide on the key points on eligibility. Some of you may want to take a photograph of that. It's got the key dates, a summary of the funding which is available. And there's the dates and deadlines. So it opened on the 31st of July, closes at noon on the 11th of October.
We missed the photo op.
Oh, did you? Do you want me to? Do you want to? Oh, I'm stood in the way, that's why. Okay. And if you're 1 second late, Leicester City missed out on the transfer at the last transfer window by 14 seconds. If you're 1 second past noon on the 11th of October, then unfortunately you'll also miss out. So, time for questions or?